Capgras delusion is a psychiatric disorder in which a person holds a delusion that a friend, spouse, parent, or other close family member, or pet, has been replaced by an identical impostor. It is named after Joseph Capgras, 1873 to 1950. The Capgras delusion is classified as a delusional misidentification syndrome, a class of delusional beliefs that involves the misidentification of people, places, or objects. It can occur in acute, transient, or chronic forms. Cases in which patients hold the belief that time has been warped or substituted have also been reported. The delusion most commonly occurs in individuals diagnosed with paranoid schizophrenia, but has also been seen in brain injury, dementia with Lewy bodies, and other dementia. It presents often in individuals with a neurodegenerative disease, particularly at an older age. It has also been reported as occurring in association with diabetes, hypothyroidism, and migraine attacks. In one isolated case, the Capgras delusion was temporarily induced in a healthy subject by the drug ketamine. It occurs more frequently in females, with a female-male ratio of approximately 3:2. The following two case reports are examples of the Capgras delusion in a psychiatric setting. Mrs. D, a 74-year-old married housewife, recently discharged from a local hospital after her first psychiatric admission, presented to our facility for a second opinion. At the time of her admission earlier in the year, she had received the diagnosis of atypical psychosis because of her belief that her husband had been replaced by another unrelated man. She refused to sleep with the impostor, locked her bedroom door at night, asked her son for a gun, and finally fought with the police when attempts were made to hospitalize her. At times she believed her husband was her long-deceased father. She easily recognized other family members and would misidentify her husband only. Diane was a 28-year-old single woman who was seen for an evaluation at a day hospital program in preparation for discharge from a psychiatric hospital. This was her third psychiatric admission in the past 5 years. Always shy and reclusive, Diane first became psychotic at age 23. Following an examination by her physician, she began to worry that the doctor had damaged her internally and that she might never be able to become pregnant. The patient's condition improved with neuroleptic treatment but deteriorated after discharge because she refused medication. When she was admitted 8 months later, she presented with delusions that a man was making exact copies of people's screens and that there were 2 screens of her, one evil and one good. The diagnosis was schizophrenia with Capgras delusion. She was disheveled and had a bald spot on her scalp from self-mutilation. The following case is an instance of the Capgras delusion resulting from a neurodegenerative disease. Fred, a 59-year-old man with a high school qualification, was referred for neurological and neuropsychological evaluation because of cognitive and behavioral disturbances. He had worked as the head of a small unit devoted to energy research until a few months before. His past medical and psychiatric history was uneventful. Fred's wife reported that about 15 months from onset he began to see her as a double, her words. The first episode occurred one day when, after coming home, Fred asked her where Wilma was. On her surprised answer that she was right there, he firmly denied that she was his wife Wilma, whom he knew very well as his son's mother, and went on plainly commenting that Wilma had probably gone out and would come back later. Fred presented progressive cognitive deterioration characterized both by severity and fast decline. Apart from Capgras disorder, his neuropsychological presentation was hallmarked by language disturbances suggestive of frontal executive dysfunction. His cognitive impairment ended up in a severe, all-encompassing frontal syndrome. Because it is a rare and poorly understood condition, there is no definitive way to diagnose the Capgras delusion. Diagnosis is primarily made on psychological evaluation of the patient, who was most likely brought to a psychologist's attention by a family member or friend believed to be an impostor by the person under the delusion. Treatment has not been well studied and so there is no evidence-based approach. Treatment is generally therapy, often with support of antipsychotic medication. Capgras syndrome is named after Joseph Capgras, 1873 to 1950, a French psychiatrist who first described the disorder in 1923 in his paper co-authored by Jean Reboulechaud, on the case of a French woman, Madame Macabre, who complained that corresponding doubles had taken the places of her husband and other people she knew. Capgras and Reboulechaud first called the syndrome l'illusion dissociés, which can be translated literally as the illusion of lookalikes. The Capgras syndrome was initially considered a purely psychiatric disorder, the delusion of a double seen as symptomatic of schizophrenia, and purely a female disorder, though this is now known not to be the case, often noted as a symptom of hysteria. Most of the proposed explanations initially following that of Capgras and Rebolleau were psychoanalytical in nature. It was not until the 1980s that attention was turned to the usually coexisting organic brain lesions originally thought to be essentially unrelated or accidental. Today, the Capgras syndrome is understood as a neurological disorder, in which the delusion primarily results from organic brain lesions or degeneration.